vets I recommend with the Spaw. We came on a little bit later. We're actually trying to figure out a new time to do it because a lot of the vets that I recommend are on the East Coast, and so they're working and very, very busy people. But then on the West Coast over here, we have people working during the day, and we don't want to keep them up late. So we're trying to figure out the perfect time to try to help everybody get on here, because this is such important, valuable information that we want to bring to you. So I know we're a little bit late tonight. So if you're coming on, and hopefully we didn't lose anybody. But tonight, one of the vets that I recommend that we're going to be speaking with is Dr. Udette Suter, who I am always so pleased to have on, because she's just a wealth of knowledge, and she gives it so freely to you in her books that she's written, the summits that she does. We're going to talk a little bit about some of the summits she has coming up. She's also going to be at our expo that we're having here in Southern California on October 1st. She's going to be doing a book signing. So if you haven't had a chance to listen to Dr. Suter, I really encourage you to listen to this episode, and hopefully you can come out to Southern California, and she's going to sign some books for you guys. And it's just going to be so fabulous for you to learn all of what you can. So Dr. Suter, welcome to the show.
Well, thanks for having me again. It's always fun to hang out with you, Carrie. I so enjoy it all the time, always.
Yeah.
And you're always asking good questions too, so making me think.
It's funny because it's like clients channel through me. It's weird. I know the questions that they want to ask you. Sometimes they're shy and they don't want to ask, but they ask me, and they're struggling with these things. So I know kind of like I need to ask this so that I can get the answers for them. So that happens a lot for me, just because people ask me questions all the time. So hi, Lily, how are you? Lily's from Virginia, so she's here. And so we're going to kind of get started.
Hi, Lily.
Before we came on, I always ask the veterinarians if there's anything special they want to talk about. And I have to say that all of you that I have in my little group here, I don't care, just whatever anybody wants to talk about, because they're so educated, and they know that I'm not going to throw anything at them that they can't. And if they don't know, they'll direct you to a place that you can. And so that's why I bring vets on like Dr. Suter, because I know that you're just such a wealth of knowledge and you can answer all of our questions. But
oh, well.
you do such a great job of answering it, and so thoroughly, and in a way that people can understand and kind of take that information and use it and utilize it. So it's just a blessing. But I did want to talk about a subject that I brought up a little bit, because it's still kind of a little bit of struggle. And Dr. Suter said, yeah, let's do it. I wanted to talk a little bit about spaying and neutering, and what are your thoughts? I mean, I know this kind of broad, and then we can narrow it down, but what are your basic thoughts on spaying and neutering?
Well, it's not a one size fits all, basically. And when we're talking about spaying and neutering here, we're talking about responsible pet guardians, parents, owners, whatever term we're using these days.
I know.
Who have their animals under, control. I mean, they know where they are, and they're not letting them run free. So we're not talking about people who are just letting their animals reproduce, randomly, uncontrollably.
Right.
So basically, it's really not a one size fits all. And there's more and more research that's showing that leaving them intact is actually helping their lives. It's helping their health. They live longer, they live healthier, they live happier. So there are a lot of aspects of the animal that are affected by spaying and neutering, or basically removing their hormones. And so there's more and more research that's showing that it's not such a good idea after all. Who knew, right? There was some part that maybe it was necessary and we shouldn't just chop it off.
Yeah, we knew. I mean, we grew up in an era where I was telling Dr. Suter before we came on, I used to watch Price is Right all the time. For any of you who used to watch it, Bob Barker that was on television on a game show. At the end of every game show, he would say, spay and neuter your pets. Remember to spay and neuter your pets. So we grew up with that mindset that there was no other way, and that if you didn't spay and neuter your animals at a certain age, you were an irresponsible pet owner. And so then it's what we learned without thinking about any kind of possible side effects, right, that could happen. And now what you're saying is, there's some side effects. What are some of those maybe that you could share with us a little bit?
Well, I mean, the spaying and neutering has been done so broadly that now we have so many retrospective studies, where they've basically shown that neutered animals are more prone to certain things, whereas unneutered, not so much. So it's something that certainly has helped us a lot, to be able to see what is actually happening. So in a way, we've done like a scientific research on everybody, on like a really broad population, kind of like they do with other things these days that we should not be mentioning here. But if you know what I mean, it's like, if you basically push everybody to do something, then you have a huge amount of numbers of participants in that study. And then if you actually were to use the numbers correctly and if it, for the right reasons, I guess, then you could really see what's happening. But I also have to mention that having grown up in Europe, spaying and neutering was not pushed like it is here in the United States. And when I grew up, I don't think I never really heard a lot about shelters in Switzerland. And we certainly didn't have any stray dogs walking around. So that was not a thing. Yeah. And again, most animals were not spayed or neutered. My childhood dog, she was not spayed until she was 10 years old. And she was only spayed because she ended up with Pyometra. So we have that risk when we don't spay females, when we leave the uterus in. But I grew up with a different way, where people were more responsible. And I'm not talking about people who are listening here, but just in general, as a population, people were more responsible for their animals. And there are still countries in Europe where it's illegal to spay and neuter unless there's a medical reason or they live near a really busy road or something.
Wow.
Yeah.
That's interesting to think that it was illegal to spay or neuter an animal. It's interesting. I mean, that's polar opposites compared to what we have here in the United States, because you will get fined if you don't, and your license costs more if you don't here in the United States. So it's so interesting. I remember the first time I went to Europe, I remember seeing a lot of unneutered dogs. Obviously, I couldn't tell the females, but the males I could tell were unneutered. So it was really interesting. That's when I first started thinking, maybe we're doing things a little bit wrong. Lily had a question for you. Don't worry, we'll talk a little bit more about spaying and neutering because it's an important topic. I also want to say hi to Jason. So I'm going to give a little shout out to Jason because he's in Sedona. And for those of you who don't know, my brother recently passed away, and I had the opportunity to meet one of his friends when I was in Sedona. And he has a cat, and he's going to start learning. He wants to learn about all sorts of stuff. So Jason, I'm glad you found yourself here. You're going to learn so much. This is Dr. Suter, so I'm excited for you.
Lily, hi, Jason.
Lily wants to know. He shares the same name as my brother, so it was kind of interesting. So, Lily says, just had blood work done on my 4-year-old Cocker Spaniel. His creatine was 1.6. Vets want to recheck, do a urinalysis to just check things. The range is 0.5 to 1.6. I asked if I changed anything in his diet, and she said no. He has no symptoms. Your thoughts? She's wondering what your thoughts might be on that.
Is it a raw fed dog?
I'm not sure. I'm going to guess. Everything else in the blood work was perfect, she says.
Yeah, because some raw fed animals, they will have higher values, certain values, such as creatinine and BUN, for example. They can be a little bit higher than in another, in a dog that's fed more of a high carb diet.
Yeah. You know what's so interesting about what you're saying right now is why it's so important, if you have a raw fed dog, which we're in support of, that your veterinarian is somebody like Dr. Suter, who understands that the raw fed dog or cat can have different values. And the baselines in the blood work they give, right, are not based on raw fed animals, correct?
Yeah, correct.
Yeah. Yeah. So it's
Yeah.
super important to have the right vets read your blood work. As she says, freeze-dried pup loaf by Dr. Morgan. So maybe not raw. Dr. Morgan, a lot of her stuff is you can cook it. So
Yeah.
maybe not raw. I don't know if you're doing. Lily, let us know if it's fully raw.
But it will still have a little bit higher, protein content.
Yeah.
So, yeah.
Do
So
you think
creatinine.
Should she be worried about that? Do you think?
Well, I mean, you can always retest it and then see, what it is. But I always thought that creatinine levels were a little bit higher, the range. I don't know if they have a different lab or something. Because the level, I'd have to look at the thing. But yeah, the raw fed dogs, they can have higher creatinine levels, basically. Yeah. BUN as well, and then the hematocrit can also be higher.
It's so interesting the ranges that they give based on, and then they just think every dog should be within this range without kind of thinking about, our raw fed dogs. I would love to see them take a coyote and compare the two together and see what's going on there. Going back to our spaying, I use freeze-dried raw by Momentum Raw Meal Bars. How do you, while we're talking about this, what do you consider freeze-dried raw?
Well, most freeze-dried food is still heated to some degree, so it's not really completely raw anymore. I was always under the impression it was, but then I learned, Chelsea Kent, her influence. She knows so much about foods and how they're processed and what goes in there and all of that. So all foods that are freeze-dried, they do go through some sort of heat process still. That is destroying some of the things, but it's certainly still better than being cooked at high heat for a long time, but still, I mean, anything that's been processed in some way, even frozen raw, I mean, it's been processed, it's been frozen. Yep. So it's not the same as if they were finding something in the wild and eating it right then and there with everything attached to it, including the blood. Because all the animals that are being slaughtered, their blood is removed, so there's no blood in there anymore. So they already also, that decreases the nutrients, because blood, for example, has electrolytes in it, more electrolytes and different, concentration of electrolytes than in the tissues, such as salts, for example, sodium, and so. Anyway, I don't know where I was going with that, but in any case, anything that's altered in any way is going to be a little bit different, not as high of a quality as they would have if they would chase it down on their own.
Yeah, no, that's why I bring that up, because a lot of times people get confused as to thinking that freeze-dried is still a fully raw diet. And I, like you, am very much believe that. I always tell people there's a scale, and if the most healthiest thing you can feed is whole prey, it's running around in the backyard when the animal eats all of it, and the closer you can get to that. But even like you said, if it's in the freezer, it's been processed. Each step becomes more and more and more and more processed, and kibble is the most processed. So I always tell people, try to stay way over on this scale, and then you're gonna be doing better. So yeah, certainly freeze-dried is better than kibble, but it's still cooked a tiny bit of heat is put in with the pressure and all of that kind of stuff. So I decided tonight to sit on this bench, so now I'm super uncomfortable. So
I'm sitting on a chair with shorts, and I'm getting stuck to it.
I'm all, I am too old to think that I can sit in a chair without a back. I'm like, I don't know what I was thinking. So anyway, she says, I feed freeze-dried hearts, liver, chicken hearts, beef hearts, and turkey hearts, and green-lipped mussels. What do you think? Yeah.
Sounds
it's great.
I wouldn't want to eat it personally, but
no,
I'm sure your dog is probably pretty happy about it.
Yeah.
Although I did get some green-lipped mussels from a company. They sold me, they sent me green-lipped mussels as a treat, and it was so fascinating to see these dogs. My patients, I would hand them one, and they're like, what is that?
Yeah.
It really smells. They would take it in their
That's-
mouth and then spit it back out. And I'm
yeah.
like, it was just so entertaining.
It's a potent smell. It's a really potent smell.
Yeah,
But
my fingers.
yeah, that and tripe. Oh, have you ever got tripe on your hands? That stuff won't come off for days.
That's pretty bad. Yeah, yeah.
But I
But
like to
anyways.
take the greenlipped mussels and throw them in my backyard and let my dogs get a couple of them back there.
Mm-hmm.
So,
Yeah. Yeah, I mean,
so
it's certainly good for them. It's just that most dogs probably have never had any, so they don't really, they're like, oh my God, what is that?
yeah, yeah. I was talking to Jason, who has a cat, and
Mm-hmm.
I think his mind was a little blown a little bit. I don't want to speak for him, but I'm telling him you need to feed your cat a whole fresh food diet, which I know, and I didn't have a lot of time to talk to him, that's going to probably be very difficult, right? Getting our cats to go on to what they naturally should be eating can be really difficult. So you usually don't want to start with something like a green lip mussel.
Well, actually, because it's pretty smelly, cat might actually go more for it than if you're
Yeah,
feeding them something else. But
yeah,
there are cats that will switch really easily.
yeah.
But let's just say that the majority of them, they're gonna tell you that you're trying to kill them
These
or
dang
poison
cats,
them,
I know.
and, and they're like, "Yeah, I'm not eating that. Forget it."
Which is so weird because the cats are carnivores, and so it's
Yeah.
very strange that you put some meat in front of them and they kind of look at you like, I'll just have my little bowl of kibble that I've had for 20 years. So it can be a little bit hard to get your
Yeah.
cats to switch. But I have found that the tripe does work. Of all of the things when I'm switching a cat over, tripe works really well, probably because it
Mm-hmm.
smells so gross.
Yeah.
It
Yeah.
smells like a dead animal. So I think they kind
Yeah.
of get it. Whereas I think our chicken doesn't smell so much like a dead animal. But
Yeah. Yeah.
um,
Well, I mean, because with the food, they put stuff in it to make it more palatable and more yeah, they get addicted to the kibble, and then they
mhm.
don't want to eat anything else. So with cats, if you want to switch their diet and they're not too keen on even trying it, you just start with like a molecule. And I'm talking a molecule. I'm talking like a little piece that you can barely see, and you just put that on the food, and then let them deal with that. And then the next day, if that went over okay, you put two molecules on it, and then you slowly increase, and then eventually they'll be switched over. But it can take several months to do that. And you may have, I mean, what I usually recommend if they're on a kibble diet is to go for a canned food first, and then slowly switch over from a canned food to a raw diet. But there are cats that will go for it. I have one client, he started feeding his dogs a raw diet, and the cat started to go on strike about her food. She's like, yeah, I'm not eating that anymore. They get much better food over there. I'm having some of that. So basically they just switched her over to raw, and she was all happy.
She just
But
did it. That's amazing.
yeah, but not every cat is like that. So
Yeah. I one of my cat that passed away not too long ago, she was 22 years old. She really struggled to switch over. I mean, really struggled. She never really went for the like raw, bloody raw. She liked the freeze dried. She'd go for the freeze dried, but I could never really transfer her over. So the four kitties I have right now were bottle fed raw, so they've never known anything. They've
mm-hmm.
they've never known anything but raw, and they love green tripe. So Jason wants to know, can you tell him a little bit? Do you know do you have a good explanation for what green tripe is?
Yeah, green tripe is basically part of the stomach of a cow. And you can actually find tripe in the store, and some of the, more, well, I know in Italy they make tripe. I've never had it, but
Me
the
either.
butcher would have it. But it's white. It's like this white honeycomb sort of structured leathery piece. I don't know how. Anyways, it doesn't sound appealing to me. But in any case, green tripe is the same, but it's just that they didn't wash it out completely, and they didn't bleach it, because the type of tripe that you can find in the store for human consumption, that one is bleached. So what green tripe is that stomach, and it has still some microbes attached to it that help the animals that eat it digest food better. So it's it's really easy to digest. It has good nutrients in it. It's not too fatty or anything like that. But it smells like, yeah. Best to feed outside.
Yeah. When I first started carrying Tripe in the store, in the spa, people would bring it back. They would bring it back and thought it was bad. And I'm on yeah. So I had to train my staff when they sell it to make sure they say it's going to smell, but it's so healthy for them.
Well, that's even putting it mildly. It's gonna stink. You're gonna think it's really nasty.
Yeah. But I've had people, I don't know about you, but like when the dog has or a cat has a little upset stomach, I give them a little Tripe. It seems to help. It probably like the microbes that you're talking about that are still attached in there.
Yeah, and it probably has a bunch of enzymes on it too, and it's easy to digest. So
going back to Macy said hi somewhere. I missed it.
Hi, Macy.
Going back to the spaying and neutering that we talk about, do you I love that you talked about, and I want to reiterate this, we're only talking to responsible pet owners. Neither one of us want to advocate you not spaying your cat and letting it roam the neighborhood. But if you're going to be a responsible pet owner, what age do you typically recommend for dogs and cats to get spayed and neutered now, or if at all?
Well, I would definitely wait until they're fully grown, because the hormones that they produce during puberty are actually supporting proper growth and closure of growth plates. Growth plates are basically kind of at the end of the bones on each side, and they are the ones that make the bone grow longer. And so during puberty, the hormones will actually stop these growth plates from continuing to produce more length. So they basically close up as a result of these hormones. And so if you spay them too early, then these growth plates will not close early and soon enough, and the animals will actually get taller. And if you spay them, and I should back up, every bone, the growth plates of every bone close at a little bit of a different time. So they don't all close all at the same time. So with the femur and the tibia, which are basically the two longer bones in the leg, in the hind leg, their growth plates don't close at the same time. And I can't remember which one closes first now. But in any case, if you spay them right between the time where one of the bone plates growth plates. Oh God, let me try this again. So anyways, the femur closes at one point and the tibia at another. And if you spay right in between these two closures, then one will already be closed and the other one will continue to grow. So as a result, then you end up with an abnormal stifle angle, and that makes them more prone to cruciate ligament tears, basically.
Oh, wow. That's interesting.
Yeah.
It's so interesting because
if you do it too soon or do it after, but don't do it right in between when these two growth plates are closing, because
does the research suggest when that time is? 2 years old?
Yeah. No, there's time, and I think it's a little bit different for each breed, because some breeds they will continue to grow for quite some time, whereas others they stop growing. What did I say? Some breeds continue to grow for a longer period of time. Like bigger dogs, they take up to 2 or 3 years to be fully grown, whereas smaller dogs, they can be done by a year or so. So it's a little bit different as far as when they close. I can't remember exactly the time when they close. Let me see if I have that.
What about?
Hold on. So the growth plate of the femur, for example, closes around 8 months of age, while the tibia and the fibula, which are the two lower leg bones, they continue elongating for another 4 to 6 months.
Oh wow, that's a big difference. Yeah. I mean, in a dog's life, 4 to 6 months is a big difference for one to be continuing to grow and the other one not.
Yeah.
Wow, that's I didn't know that. I knew that it had something to do with the growth platelets, but I hadn't had it explained to me like that in the tibia and fibia. I'm so glad that you explained that. I can't wait kind of push that along and let people know, because wow, how dangerous. What about cats? Because I know cats don't grow, like they don't have all variations in size, but what about spaying and neutering cats?
Well, there are not a lot of studies on that, or any really. It doesn't seem to be quite as big of an issue, or maybe they just haven't looked. I'm not really sure on that, to be honest with you. I'm Shell again. I saw her earlier. Anyways, yeah, with cats, there's just not a lot of information there. And I mean, if you have a male cat and he's fine not being neutered and he's not being a total pain in the butt, and you have him inside, and because obviously if you let him loose, he's going to make babies everywhere. Certainly, you could also do some vasectomy and then let him loose. And certainly some of the cats in the neighborhood would probably love it. But with cats, it's a little bit different, because the female cats, they cycle until they become pregnant. So they're not like in heat, and then they could be get pregnant, and then they're out of heat, and then they don't come into heat for another 6 months. With cats, it's really that they come in heat and then they go out of heat a little bit, but because they're not pregnant, they go back into heat. So it's like continuous. And so with females, if you have a female like that who is whining and crying and being really obnoxious because she's in heat and she wants to find her boyfriend, and you have them indoors, that can be very challenging to live with. They every few weeks they come back into heat, and it's like this never-ending cycle of crying in the middle of the night when you're trying to sleep. So usually what I recommend is to spay them at that point, when they start to become obnoxious,
screaming and hollering.
Yeah. But there are some where it's somewhat tolerable, and male cats, they can be quite tolerable as well. I mean, my sister, her male cat, he wasn't neutered for quite some time, and he was just fine. I mean, but then he was, let outside to go outside, so then they neutered him. But
what do you think about? I have a lot of people tell me that their dog trainers tell them that they have to neuter them before they're 6 months old because they're too hard to train. They'll get aggressive. Have you heard stuff like that? Like you need to neuter them so they don't get aggressive?
Well, it's actually quite the opposite. Behaviorists nowadays, and I'm talking about board certified conventional behaviorists, are now recommending against neutering when it comes to behavior issues, because a lot of behavior issues can actually be made worse by neutering. So, and we have no way of checking, because, once it's gone, it's gone, once the balls are lost, there's no putting them back on. But back when I was still practicing in Switzerland, we actually had a drug that's not available in the United States. I think it's still available in Europe, where we could chemically neuter them. And the drug would only last for, I think, a month or something like that. And then it was gone, and then they would start producing testosterone again and sperm and everything. And so we would do that as a test to see, is that actually changing the behavior? If we inject that, is that changing the behavior? And then we would base the decision on neutering or not neutering on the results that we would get from that chemical temporary neuter.
Wow. That is, do they do that on humans?
Oh God!
I was thinking,
Carrie, who do you want to neuter? Hey,
well, my teenage boys. They're not teenagers anymore, but I was like, wow, that would have been really, because I was, like.
Did they torture you or something?
No, but it was always a fear, like, oh God, they're gonna get somebody pregnant, and because. I'm sorry, but they were teenage boys, and I was always
they make condoms and stuff, so
right, I know, but they got to remember to put it on, and they can't even remember to take a shower when they're a teenager. So are they gonna? Sure. I don't know. That was just my little. Obviously, I don't want us to temporary neuter our children, but our teenagers.
Yeah, well, the thing is, then they will start like these they sound like I don't know how you pronounce that word in English, eunuch, like the monks that they would castrate so that they would keep their high voice.
Oh, I know what you're talking about, but I don't know.
I don't know how to pronounce that word.
Yeah.
I can see it in German, but I don't know how to pronounce it.
It'll come to me in a second.
Yeah.
I'm not alone, though. I just want you to know, Michelle has, I can think of a few people.
Yeah, of course.
So now I don't feel so bad.
So Jason, I don't think usually it goes that way. So anyway, so going back to this spaying and neutering.
I know. I missed that. Hides in the corner. I think I missed that, Jason, a little bit.
Is that Jason? Jiva is Jason?
Yeah, Jason is Jiva, yeah.
Oh, hides in the corner. Are you hiding in the corner now?
Oh, I get it.
Well, if so, then you definitely have a sense of humor. Yeah, I like it.
That's good. That's so funny. So when we're talking about spaying and neutering, now I got to get all serious here again. Traditionally, when we spay and spay a female, right, we're taking the uterus out. But aren't there other
ovaries
options, right? I mean, the ovaries. There's other options, right?
Yeah, so the newer option that we also have available, I mean, not every vet will do it, but is to just take the uterus out and leave the ovaries in. Not a lot of dogs have had that procedure so far, and it's not been that long that we've been doing this, so we don't really have any idea of what the long-term effect, positive or negative, is going to be. So maybe in a decade or two, we'll have a little bit more information on that. We need to have higher numbers, but the problem is, they still go into heat. They will still behave like an intact female, and some people just don't want that. They want to get rid of it, and they can still potentially have false pregnancies in the sense that they act as if they had been pregnant and then carry around their babies. And for some females that can be a little challenging.
Yeah. I had a dog a long time ago that had a false pregnancy. It was sad. Mm-hmm. And I was really young. I didn't know what was going on. And I'm like, oh my God, she's pregnant, but she never was. She just, it was very stressful for her. Mm-hmm. But that's called an ovarian saving spay, right?
Yeah. Yeah.
I have one veterinarian in Orange County that does it, and she actually doesn't always recommend it. But she says that she can do it and she will do it. But like you're saying, there's not a lot of vets that do it. What about for the males? Can they get the vasectomy basically?
Yeah, they can get a vasectomy, but the only reason to really get a vasectomy is if you have an unspayed female and you just want to leave them all together and you just want to have some safe sex going on, I guess. Or if you have, I know.
Now I'm acting like I'm 4. I'm just laughing. I don't know.
Or 13?
13 or 14. I'm acting like a 13 or 14-year-old boy here.
Or a girl who's giggling, as the boys walk by.
Now I'm getting embarrassed. But anyways, the only reason really to do a vasectomy is if you have an animal that's coming from a shelter or from a breeder and they require that you neuter him. It's, if it's in your contract. Otherwise, there's really no good reason. Because if you have them under control and that you're not just letting them roam around freely, it's not really a problem. Yeah. Well, a lot of people, for me, people will say to me, well, I don't want a marking all over my house. And I always say the same thing to them. I have so many unneutered dogs that come to doggy daycare and they're still marking. So and they're neutered. So I don't really know what your thoughts on that?
Well, a vasectomy is not going to do anything for the marking because they still have the hormones. Right. And if anything is to blame for the marking, it would be the hormones. A vasectomy is basically just cutting if you have a water hose with sperm coming through, if you just interrupt that, then the sperm just can't come out. But hormones are still being produced just as much. So
yeah. So no point.
No, there's really no good point, no good reason. Plus, anytime you cut into something, you create scar tissue, which then puts tension on the area, but also puts tension on the entire body because everything is connected through fascia. So it can cause tension in the neck, it can cause tension in other places. So cutting into something for no good reason or no benefit, I wouldn't do it. So
Yeah.
the only reason is just if you have a piece of paper, and they wouldn't give you the dog unless you signed it and are going to do it, and then send them proof, basically. you
Yeah.
know
Yeah, you have to weigh all these options. I know I'm one of the few doggy daycares and boarding places that I will take unneutered dogs. But
hmm
that's something you have to ask if you're going to be traveling or you need that. Some places won't take you if your dog's unspayed or
hmm
neutered. So you have to weigh
hmm
all those options. So
hmm
let's talk a little bit about the hormones, right? Because that's what ultimately we're talking about. What hormonal problems do you think? I know you had talked about, if the growth platelets, they're growing separately at different times, but what about the hormones? Like, how does that what negatively can be affected by removing those hormones that you know of?
So, just a quick little correction so that everybody uses the right term. It's growth plates.
Oh, thanks. Sorry.
It's not platelets, because the platelets would be what you find in the blood
In the
that
in the
help with clotting. So just,
Thank you.
just
Yeah.
wanted to
Yeah.
clarify that. But okay, now I don't remember what you asked. Can you repeat the hormones?
Hormonally speaking, how when those hormones are taken away, what I know there has been some research on Cushing's disease, but what else can be affected if we do that? What else?
Well, incontinence is definitely a big one. We see that quite frequently because, especially in females, and males probably too. I'd have to do a little more research on that. I can't remember. But the sphincter that basically closes up the bladder, so that urine doesn't leak out,
Right.
actually has estrogen receptors on it.
Oh, wow.
And so, if there's not enough estrogen in the body because you remove the ovaries, then they can become more incontinent because the receptors are basically what trigger the sphincter to close up. So they can become incontinent, and that tends to happen a little bit later in life. I mean, in some dogs it will happen earlier in life, but the hormonal when we remove the hormones, the adrenals start to take over a bit, because they produce hormones as well. They can produce testosterone, progesterone, and estrogen as well, and that's what happens in us, human females when we go through menopause. Then the adrenals start to kick in. But if the adrenals are a little compromised in an older dog, that everything kind of slows down a little bit, so the adrenal glands may be making less hormones, and so then as they get older, they can become more incontinent, more easily incontinent because they just don't have enough of the hormones. So that's certainly one of them, one of the things that can happen. And then, I mentioned the skeletal abnormalities. I mean, they've seen a lot more issues with cruciate ligament tears. Hip dysplasia is also more common. Patellar luxation is also 3 times more likely. Joint disorders in golden retrievers and labs, they have found that it goes up by 5 times, 5 times more when they're neutered and spayed. It also affects their lifespan. They were looking at female dogs that were spayed before 4 years of age, and that reduced their healthy lifespan by about 30%, which translates to about 3 to 6 years, depending on the breed, which
Yeah.
that's a huge amount.
Yeah.
They're also more prone to all sorts of tumors, including hemangiosarcoma, bone cancer, prostate cancer, bladder cancer, lymphocytoma, mast cell tumors, that sort of thing. There's also an increase in occurrence of hypothyroidism, infectious diseases. They're also more prone to having adverse reactions to vaccines, behavioral problems, noise phobia, fear behavior, aggression, ADD like behavior is also increased. Apparently, they will also roll in and eat feces more commonly than non-neutered animals,
Wow.
which is kind
Wow.
of gross. But
That is pretty gross.
Yeah. And then they can also be more prone to having pancreatitis. Weight gain obviously is a big issue. A lot of animals, after they're, have their hormones removed, they will gain weight, and then decreased energy level as well.
Wow.
So lots of things that are, things that you don't really want to see in your animals, right?
Yeah, it's so interesting. I mean, it took you probably 2 minutes to read off all of those things that can happen if we, we're spaying and neutering our animals. And when we were talked into spaying and neutering our animals, what they would say is that your female. They never really said too much about the male, but the female would get cancer. Um, and then later
Mm.
on, I would hear about Pyometra. So let's talk a little bit about those risks. Because they are a risk, right? Like particularly, I think we should talk a little bit about Pyometra because I think that's a big one. So can you explain a little bit about if we're not going to spay our females, what we need
Yeah.
to look out for?
Yeah, so they can get pyometra, and what pyometra is basically an infection within the uterus, because what happens while they're in heat, they produce more material in the uterus that would then allow the egg, the fertilized egg, to implant. It's basically the placenta. And so when they're done with their heat, that layer doesn't go away; it just stays there. So with each heat, that layer will get bigger, and it also kind of has cysts in it and such. And that's the perfect breeding ground for microbes. And while they're in heat, the immune response in the uterus will be decreased, because otherwise the sperm would get killed when it comes in, because it's a foreign body, right? So the immune system would kill that. So in order for successful fertilization, the immune system has to be, dialed down a little bit so that it can happen. And then at the same time, while they're in heat, their cervix will open up as well. So things can go in more easily. So microbes and that sort of thing. But then after they're in heat, the cervix closes up completely. And then you have these microbes in there and that perfect breeding ground. And then they can proliferate and have a party in there. And then it turns into like a pus filled sort of, sac. And
Yeah.
sometimes they can have an open pyometra, which means that the cervix opens up just a little bit again, and you can see pus actually coming out of the vulva. But oftentimes they will have a closed pyometra where you don't see any sort of secretion, but the uterus will get bigger and bigger and bigger until it ruptures. And that then becomes a big mess, because if you have pus everywhere in the abdomen, that's not ideal. Plus they get quite toxic from that because of the release of all these microbes. And it can also cause some issues with the kidneys. And that's one of the signs that we see. One of the top signs is that they start drinking a whole lot all of a sudden. That's like a telltale sign for pyometra. For example, my childhood dog at 10 years old, she got pyometra, and in the morning, I was still out in the woods with her. I think we went for like a 2-hour walk. We went to a totally different neighborhood and um, had a lot of fun. And in the afternoon, she was on the surgery table having her uterus removed. So that's how quickly it went. We got home, she was drinking a whole lot, and I must have known that was a sign. But in any case, we had her at the vet very quickly, and they got it out, and everything was fine.
Yeah.
But that's certainly a risk. And the older they get, the riskier it becomes, because they just don't have that young life force like they do, when they're like 2 years old or so. But on the other hand, they may also never have a pyometra. I mean, they're more likely to have one than not, honestly. But I talked to a colleague of mine who works the Iditarod. So she works with a lot of these athletes, really. And she says that these huskies that they use for the Iditarod, they're not spayed, the females. And
Right.
even when they retire them, they're not spayed. And she said that she's never seen a pyometra in them. And I asked her why she thought that was. And she said that maybe it's because they just, run so much and stretch out. Because every time they run, like their whole body stretches out, and it may also just massage that whole area of the uterus, bring more blood flow to it, and just clean things out more easily that way. I mean, she didn't really know for sure, but I thought it was interesting, that would happen. But I mean, one way that they would clean it out would also be by being pregnant, so which is what would happen in nature. They would get pregnant at least every few heats, I would think, depending on where they are on the totem pole. So nature, in theory, takes care of it, but because we don't let our females get pregnant all the time, we end up having to do something about it.
Yeah. So what I'm hearing is like obviously letting them have puppies, which I'm not suggesting we do, but
Mm-hmm.
that is one way that nature takes care of it. Do you think there's something else if someone's choosing not to, like, will the raw diet have an effect possibly? Probiotics, do you think any of those things can help prevent pyometra if we choose? Because I'm listening to all the lists of stuff from spaying, and like I said, and then over here we don't have a huge list, but we do have some pretty serious risks. A dog can die from pyometra, right? So
Yeah, I mean that's why we can do the ovary sparing spay,
yeah,
where we remove the entire uterus. So we can do that. But
yeah.
I mean, we don't really know what's going to happen down the road, but they certainly can't get pyometra anymore because the uterus is gone.
Yeah, yeah. So that prevents that.
Mm.
And then what are the? I'm so sorry. Lori's dog had pyometra, and they had to
Oh
have
yeah,
her treated
yeah.
with surgery. I remember when that, but that was the cure for it, so to speak. Was she had to get spayed, just like your dog. Um, Now, what about the cancers that they talk about? Because that's what they scare you. You have to because your dog is going to get cancer. What? Tell us a
Mm.
little bit about the cancers if we don't spay our dogs.
Yeah, so with the females, the cancer that they're talking about are the mammary tumors. So they feel like, there were some studies done that showed that they would have an increased risk of mammary tumors. But then when they did an analysis of these studies that were done, it actually was not quite the case. So the studies that were done were interpreted incorrectly. So it's not really the case. And especially in female dogs, if they do get mammary cancer, only about 30% of them are actually malignant. The rest of them aren't. And my childhood dog ended up with tumors in the mammary glands, and they were oozing a little bit and such, but they weren't huge or painful or anything like that. So she lived just fine with them. Now, I'm not saying that that's
Right.
what we want, but
Yeah.
for her, it was definitely not the end of the world. I mean, she had other issues that then, um, led to her passing. But in any case, the studies that are out there are still being quoted that, if you spay your animal before the first heat, there's 0 chance of tumors. If you wait until the second, have them have 1 heat, then it increases and then it just kind of goes up exponentially. But again, that was sort of when they looked at the studies a little more closely, it just, those numbers were not right.
They're not
So
correct.
yeah, but you definitely want to, if you have a female that is intact, you definitely want to keep an eye on the mammary glands and see what's going on. With cats, if they get mammary tumors, those are I think 90% malignant. So that's a whole different story for cats. But for dogs, it's not horrible.
Not
Um,
horrible.
yeah, and then with prostate tumors, we have to differentiate between benign and malignant tumors. And benign prostatic hyperplasia, that's usually a testosterone thing. So the prostate just enlarges from the testosterone. And if that's the case, if it comes to a point where the prostate is putting so much pressure on the urethra that they can't urinate, then you can just neuter them, and that will take care of the problem. And then, the prostate will shrink back down.
Yeah.
So that's not really a reason to neuter, in my opinion, especially if they don't have any problems. And when it comes to testicular tumors, that's also not a huge risk, basically, because Oh no, never mind. That was about retained testicles. But yeah, testicular tumors are a possibility too, and just end up removing them if that's the case. But
Did
yeah,
I
with
miss a
retained testicles, what?
I said, did I miss a question? I think I
No,
missed
we
a
were still talking about tumors.
Oh, I thought somebody asked a question about oh, you were looking at some I thought somebody asked a question about the testicles being just where they didn't drop.
No, that was me.
Oh, I thought you were reading the monitor
No,
too. I'm like, did you see a question I missed? I tried to do just a good job.
no, I'm reading an article I wrote because I
Oh.
can't remember it. Yeah. But
See,
anyways,
this,
it seems like prostate tumors are more common in neutered dogs than in
and
unneutered dogs.
isn't that interesting how we were just
Mhm.
I mean, I remember as a vet tech telling everybody you had to spay and neuter and so they wouldn't get
Mhm.
cancer. And now, we learn
Mhm.
so much more and we come out and I don't know. It's just everything you wish you knew to create. Oh, that's from Lori. She's posting stuff for Dr. Udette so you can get a hold of her. Thank you for
Mhm.
talking about spaying and neutering. I think it's so important to know both sides of every single, I don't want to sit up here and tell people you should never spay and neuter your dog. Then they get Pyometra, then you call Dr. Odette Setter up and you're mad and or me. And so I really like to give you both sides and then you make the decision because we can't ultimately see the future. And
Mhm.
so thank you so much for giving us both sides of that because there are risks in both. I do believe the risks are far greater when we're messing with nature, when we're taking away something that nature gave us and thinking that we
Mhm.
don't have any side effects to that. I think is a little dangerous. So
Yeah, I think that every time humans try to interfere with what nature gave us, it kind of backfires.
it does. It
You know,
backfires
it
against
really
us.
does. Because I
So
think it was in Hawaii or somewhere where they introduced some sort of rodent, and then they had too many of these rodents, and I can't remember the exact story. And so they introduced a prey animal, like a not a prey animal. What's the opposite?
something that eats animal
Yeah,
prey.
that exactly. That eats the prey. I know there's a word for it. Well, a carnivore, I guess.
Yeah, carnivore.
But in any case, God, words today are not flowing. In any case, what happens is they introduced one that lives that is awake at a different time than the other one. So one
Oh,
was nocturnal and the other one was awake during the day. I'm like,
I remember
so
that. And
they never met.
never,
I'm
nope.
like,
I remember that. And now they had two animals that
two
shouldn't be there.
problems. Yeah,
Now
they had two problems
they
now.
had two problems now. Oh
Yeah,
my, they
yeah,
got to introduce the third. And oh God, yeah. No, I mean,
yeah,
sometimes we just mess with nature and
yeah.
it
But
doesn't,
it's just so stupid. It's not even thought through. It's like, oh my God, somebody's just not thinking. It
yeah.
just, it's
Yeah.
crazy.
We do it a lot. Let's talk a little bit. I know you have, we only have a little bit. I always want to not, take up too much of your time, but you have
Right.
a couple summits coming up. Tell us a couple of what you're doing.
Yeah, so there's a summit. It's the Dog Lovers Summit or Pet Lovers, no, Pet Lovers Summit. That one's going on right now. So that's like one little interview every day for 21 days, I think.
Mm-hmm.
And then there's also the Decoding Your Dog Summit. I don't think that one has started yet, but it's
Yeah.
also a similar format. If you one or two lectures a day, or interviews a day. So certainly something to tune into. I'm one of the speakers. There are a lot of other speakers, and then there's the Redefining Health, a Pet Wellness Expo.
That's yeah. Of course, there's that one. Of course, I'm going to talk about that one. I'm so unbelievably excited about
Yeah, me too. Me too.
finding
Especially it's a live thing, where we
alive.
actually get to see people.
It's alive. That's how
Mhm.
I met you the very first time was at a big expo, and
Yeah.
it's just different. It's just
Hmm.
the energy you cannot create through a screen.
Mm-mm.
It's so hard to create that energy. and to be there and to learn and to listen and to bounce ideas off of each other and not worry about someone's screen going down and all of that. So I'm very excited about the redefining pet health, but
Mm-hmm.
it's so exciting to me though that these things are going on all over, because right now it is so hard to get into your veterinarian. It is harder than it's ever been. And so if veterinarians like yourself are willing to help and give people some information so that their pets are healthier, then even the pets that aren't healthier get the care they need. Because right now it's just so overwhelming that we have animals dying, waiting in parking lots to be seen by their veterinarians. So
yeah, it's really, really sad. Yeah.
yeah, and it's awful. So for all of us making our pets healthier, we're actually not just helping our own pets, but the people who may not have the resources to learn what they're learning might get the care they need for their sick pets. My own pets, I'm fortunate, I don't have to take them to the vet very long. So they leave a spot open for somebody that does. That's how I always look at it. But the Redefining Health, that expo is, what are you going to be talking about? I know, but share a little bit about.
I think I'm talking about the 7 pillars of health, I think, right?
Yeah. 7 pillars of health.
I think that was what we decided.
Yeah, I think sometimes people like it. I love that you're going to break this down, because it's not hard. If you follow these 7 things, right? It's going to, it's going to be great. So I just.
And we're going to talk about fundamentals, because fundamentals are overlooked and ignored, and because we're so trained to have a pill for every ill. You see a dog with allergies, they ask me, what kind of shampoo can I use? I'm like, well, that's not the question. That's like, I have duct tape on my car engine light that came on. How can I remove that? Oh no, the car engine light is coming on. How can I get rid of it? Well, take a piece of duct tape.
Yeah,
and you won't see it.
Oh my gosh.
So it doesn't really do anything. So we really have to look at fundamentals, and so that's what it's going to be. Fundamentals that everybody needs, even in the holistic field. I see it all the time. People do not know about the fundamentals.
Yeah.
They just use natural things and they think it's holistic and all good and everything. I'm like, well, how well is it working for you?
That's the best question. That's the best question. Is it working for you? I know that on the back of dog food, as much as I research about pet nutrition and learn, I remember when I first saw the word natural flavoring, and I had to really learn what that meant and what it was. But you're right, the Band-Aid, I'm going to use your analogy of putting a piece of tape over the check engine light. I think I'm going to trick my husband. If mine comes on, I'm just going to go put a piece of tape over it and see.
Well, as long as you're not using the car and you're using your husband's, and
I'm just going to be like, what do you mean that didn't work? I can't see the light anymore. So mad. He can fix anything. So he'll be like, what did you just do? Because he'll understand that obviously doesn't work. Yeah. As a groomer, I get people often who, I just had a phone call today with a guy who wanted to know if he could bring his medicated shampoo in for his dog. And of course I said yes, but then I'm going to try to have a talk with him when he gets there about finding out.
And I'm not saying that shampoos are not helpful. Sometimes we have to do something to extinguish the fire, basically, and then help rebuild the body after the animal is feeling better, because the top priority is still quality of life,
right.
So I will always have that as my top priority. And then once they are at a somewhat comfortable level, then I can start working up the actual underlying problem, and help heal that.
Agreed. Sometimes I do interviews with holistic. I don't want to call them too holistic. I don't know what the word is. There's a word that I'm going to probably have to make up one day, where holistic approach gets too deep and the animal's suffering waiting for the holistic approach to work. And I don't like that approach. That's not the approach I'm a big fan of.
Oftentimes, and you may not be talking about holistic vets, but just holistic approach. Oftentimes I hear people say, oh, I've tried this, that, and the other, and my dog has been detoxing for a year.
Yeah.
because of what they see on the skin. I'm like, that's not detoxing. That's actually not detoxing.
Yeah.
That's actually not being able to detox properly, for example. So if what you're trying to do is not giving you results within a couple of months, you should see some improvement,
Yeah.
And
Yeah.
there are obviously cases that are difficult, but if you're not seeing some kind of improvement with what you're doing, it's not working.
It's not working. Yeah.
It's
Yeah.
just not working.
Yeah, I've seen animals suffer for a really, really long time, and they won't. They just think, "Oh, I gotta just stay the course and keep going." And meanwhile, the dog's not. You're right. There's no improvement, and that always hurts because they don't. It's not like people. Like, we can live to be 80, 100 years old, and maybe 5 years to get to that maybe is okay. But for a dog, a whole year is a long time.
It depends on how bad you feel in the process. Yeah. I mean, I plan on just falling asleep in my bed one night and not wake up. That's how I plan to exit.
That's my plan too.
Yeah, but the thing is with health, the health is something that we need to learn about. It's like learning to fly a plane. You're not going to do it on your own, right? Hopefully, because hopefully you won't even be able to get the plane to take off.
Yeah.
So you're not going to go on Facebook and ask a bunch of people who know nothing about flying a plane and think they know to go fly a plane. So you want an instructor, and the same goes for health too. You need to have somebody who's actually teaching you how to do it, and that's what I do. That's my goal, is teaching people about health and teaching them a shortcut, because believe me, I mean, I didn't get here without having my own health issues and having to work really hard at turning those around, so.
I think
I know what I'm talking about.
Yeah, you do. And that's the thing, is getting you guys to the shortcut. It took me forever to learn what I know, and I'm still learning. And that's why.
Yeah. I mean, we never stop learning. I mean,
hopefully. Jason says he learned so much. I also learned it only took 30 minutes before the ladies brought up neutering men.
Only 30 minutes, huh?
To be fair, I was talking about rotten teenage boys that were mine. My rotten teenage boys. So, but anyway, Jason, I'm glad this was the first time he was able to come on. I hope to see you. We do this every week. So I'm hoping we're going to see you guys all on here a lot more and learning more. Dr. Suter, can you just tell us the name of your book and where they can get it? I just want to tell you guys, this is a book. Like, if you don't want to leave your hometown, go to a summit, you can't come to the wellness retreat or the wellness expo that we're putting together, just read this book at least. Do this favor. What is it called, and where can they get it?
It's What Your Vet Never Told You, Secrets to Something or Other. I can't remember what the rest of it is. I meant to
bring one home. I had one. I know the name of it, but where all can they get it?
On Amazon. Yeah. So if you just Google What Your Vet Never Told You on I guess there's no verb for to Amazon.
To Amazon.
Like you Google something, so you Amazon something.
You Amazon it.
Maybe we should have a new word, like a verb.
Lori will put it in. I know, right? Amazon it.
Yeah, Amazon it. Yeah. And then, for those people who really want to go deep, I also have a program where I talk about the 7 pillars of health, and really you get some training that way, and Q&As, live Q&As. I have a lot of fun. It was kind of that day.
It's so important, especially for people who are in an area where there aren't good holistic veterinarians that can guide them. And I know Jason lives in Sedona, where my mom is, and I have tried many times with my mom to get her animals to the right vets, and there's not a lot of choices. And so getting involved with Dr. Suter, getting her book, going on to these summits, getting involved in these classes and learning this stuff can do wonders for you. So I encourage you all to do that. But hopefully I will see you at our
I would love to see everyone in California.
Yeah. It's gonna be a lot of fun, and it includes lunch, and we're gonna be there a whole day, so it's gonna be a lot of fun. So
well, the thing is too that you're with like-minded people, and it's like when I go to a holistic vet conference, it's like you can relax because everything is just really, you have family, everything. You can kind of relax. You can be yourself. You don't have to put up barriers and protection because people are coming at you because they think you're crazy because you're among crazy people. So your craziness,
Yeah.
it's just it's so rejuvenating. It's just so nurturing to the soul, the heart, and just having like-minded people around, that share the same beliefs and ideas and openness and love. And it's really amazing. So just for that, I mean, I usually go to the conferences just for that. I don't even go to the lectures. I just hang out with my people, because it's just, yeah, it's just nurturing the soul.
It is. The first time I went to one was the Dogs Naturally magazine summit in Chicago where I met you. And I had been to the Pet Expo. I had been to lots of expos, but I had never been to one that was very specific. And I remember telling my friend at the time, I feel like I'm at a meeting, like where I'm going, like a I don't know, like how people would feel if they went to like an AA meeting. I felt like I was at a meeting where I didn't have to hide behind anything when I said I fed my dogs a raw diet. Like I didn't have to sneak and be like, oh, well, I don't really give them all these vaccines and my 8-year-old golden isn't spayed. And it was just really freeing and it just felt great. And I learned a lot too, because I always want to keep educating. So you're right. It's nurturing to the soul for sure. So I'm excited. And we have such speakers, the panel of speakers that we were able to put together. I think you guys were all biting at the bit and I got lucky because I just kind of said October 1st and all of you guys were like, let me out of my house. I want to go speak. So we got really lucky. So, well, thank you so much for taking the time and being here again. As always, you're just so full of knowledge, and I get so excited to talk to you. And it's been great. To all of you guys,
thanks for the fun.
Yeah, of course, always. It's always fun. It's always fun. To our listeners, you guys, thank you so much for typing in your questions. They are so very, very important because we're helping educate everybody so that everybody can educate. Like it just keeps going. So we need your questions to help us kind of guide us what people need to know. So thank you and keep coming back. Lori is behind the scenes. She's the one typing out all that stuff for you because I'm not very good at the computer. So I like Dr. Suter, you see her reading and communicate. That's not me. I can't do that. So thank you.
Yeah. Thanks, Lori. And thanks everybody for being here. And thanks, Carrie, for all the passion that you have. And yeah, you're spreading a lot of good.
Yeah. Thank you. I love
it. Thank you for that.
All right, guys, have a safe evening and we'll see you next week. All right. Bye, Dr. Suter.
Bye, everyone.